Good morning, everyone. Thank you so much for taking the time out of what is surely a hectic or certainly a busy few days as you get started back on this semester. And welcome to those who are new. We have representatives and experts from Aetna here with us today to help you better understand the dental and vision programs that are offered. These programs are voluntary, so they're sponsored by the university and the fact that we roll them out to you, but they are managed completely through our team at Aetna. We've got Corey Urban, who is a sales executive for dental and vision products. We also have Kevin McDonald and Matthew Baker in the background, part of our superb Aetna team. So they are here taking the time to answer questions and present this to you so it's as clear as possible, so you can make a decision on whether or not you want to participate. You have until September 30th to do so. So with that, I'm going to pass it over to Corey, and he can start talking about all things fun and exciting regarding dental and vision.
Let's do it. Thank you, Karen. Yeah, so like everyone has said, thank you all for joining today. Sure you all have tons going on, so we definitely appreciate you taking the time to listen in. My name is Corey, and I'm here with Matt and Kevin. We're going to tell you all about the optional dental and vision plans that Columbia is offering. Now, you might be already enrolled or still considering, but regardless, this session will be helpful in either situation. But I'll call this out now that it's totally unrelated to the medical insurance plan offered by Columbia, and you or your dependents do not need to be on that plan in order to sign up for the dental or vision. You can flip to the next one, Matt. Perfect. So I'll start by walking through the plan design and benefits at a high level, starting with dental. I'll tell you how to enroll online and then what you would receive after enrolling, along with some of the resources available to Aetna Dental and Vision members. And then we'll have some time for Q&A at the end, but Matt and Kevin, like Karen said, will be monitoring the chat or the Q&A box throughout the session. So we can jump to the next one. All right, let's dive into the dental plan. So you'll see in the top left corner the policy number and the effective dates. This plan went effective on August 15th and is active until August 14th of next year. Like Karen said, you have until the 30th of this month to enroll for the full plan year. If you did want to wait, you can enroll for the spring-summer portion, which is effective on January 1st. Now that enrollment period opens up on December 13th, I believe, and closes on, yes, February 15th. But I will say it'll cost you the same amount no matter what time you enroll, $427. But this plan, it's a PPO plan or preferred provider organization plan, meaning that you have in and out of network benefits, meaning you don't need to have a primary care dentist or need any referrals for any of the care that you get. You should still strive to stay in network with your care. So while the co-insurance percentages are the same for in and out of network, we have contracted rates with our providers to charge a certain price, whereas the out-of-network providers could charge much higher. And you also need to typically submit a claim for yourself when you go out of network. But co-insurance, in any case, if any of you aren't familiar, in this sense, is how much you will be responsible for paying. So it will either be 10, 20, or 50%, depending on the type of expense. You'll notice that these type A expenses, and I'll get more into those in a bit, are not subject to the deductible. Now, the deductible is just a dollar amount that you need to reach or pay before the plan, quote unquote, kicks in. So for type A expenses, all that means is that the plan will pay 90% of the charge right away. That just means that the deductible does not apply there for those expenses. And so you'll see here the deductible is $50 for an individual and then $150 for the family. And then the annual maximum is just the maximum amount that Aetna will pay out related to your dental care during the plan year, and that is $1,500. Now, I will say though, this is just a high level snippet of your plan. The full plan design is on our Aetna Student Health website, which we have the URL of later on the slides, and we can paste that into the chat later as well. But yeah, you can flip to the next one, Matt. I wanted to talk on this slide quickly about what those type A, B, and C expenses are. You probably never heard of those, and what some of the common procedures within each of those categories were. So, type A would be diagnostic and preventive care. That's your basic stuff. That for this plan, it includes two routine oral exams and two problem-focused visits per year. Again, covered at that 90% always. Type A also includes your cleanings, which you get two per year, along with some more basic or simple images and pathology. And then the type B expenses are for basic restorative care. This includes some more in-depth images and pathology, amalgam restorations or composite restorations, root planing and scaling, retrograde fillings, uh, root canal obstruction treatment, and extractions. Now, I don't expect all of you to know what all of these types of dental care are, but most likely you would know already if it applies to you, or you might be thinking, oh, I don't see X or Y on here, but these were just some of the more common claims that we see. And I do, again, highly recommend checking out the full plan design and benefits summary. And then, so for type C, that would be major restorative care, such as inlays, labial veneers, crowns, dentures, more quote unquote major care. But one call out I guess I will make here is that the surgical removal of impacted teeth, including wisdom teeth, falls under type C. But impacted wisdom teeth are covered under the medical plan at a higher percentage. So if you are enrolled in the medical, I'd make sure to utilize or at least look into using the medical plan benefit versus the dental plan in that situation. And then lastly for this, oh, the exclusions. Some common exclusions are cosmetic services, coverage outside the US, Canada, or Mexico, anything non-medically necessary, and any services provided by someone in your family. Again, full details and full list of exclusions are in the plan design. You can flip the next one. Now, this slide I won't spend too much time on, but the message here is that you should try to stay in network. We have over 429,000 providers, coast to coast. So finding one in network nearby to help you, one, save money, two, maximize the plan benefits should be easy. That is our goal. Again, no referrals are needed with the plan. You do have the freedom to go wherever you would like. Now, no, that's perfect. You can flip ahead. So we'll put all of the links in the chat shortly, but to show you how to enroll really quickly, first you would navigate to Columbia's page on aetnastudenthealth.com. You'll see these four buttons. You'll click the one that says enroll in dental or vision. So this is how you enroll for both. And that opens up the page on the right-hand side of the screen. And now, if the whole, again, oh, this is a good call. If the whole deductible or the co-insurance language is confusing, there is a healthcare 101 document on that page that's super helpful. So I would check that out. But at the bottom of that page, you also see the plan design links that I keep talking about. The vision plan design is further down when you scroll. We'll talk about that plan soon too, not to worry. So you click enroll. We can go to the next slide. And then on this screen, you enter your ID number called, it looks like the UNI or PID, but minus the C when you type it in. And then you type in your date of birth. And then the next page opens up where you select let's see, you select the plan or the plans you want to enroll in, and whether or not you want to add your dependents. And then you would hit continue. You're asked to enter some personal information such as your name, email address, phone number, and your actual address. Same for your dependents. Make sure when you're doing this to use your current address because the welcome letters would be mailed there, and you want those. And then the following page would ask you to enter your payment information and then submit, and then you'd receive payment confirmation, transaction number. You can flip to the next slide. So these are the welcome letters. And after enrolling, and again, this is for dental only right now, but a welcome letter will be sent to the address you used when you enrolled. It's typically mailed out 5 to 7 days after enrolling. It'll look like what's on the right-hand side of the screen here. It has your member ID, your ID card, the paper version, and some other helpful information. Now, if you did need to see a dentist immediately, I would say to contact Aetna Dental customer service and they can help you obtain your ID number. Again, if you need it immediately. And then using that member ID from the welcome letter or wherever, you should create your online account as soon as possible. You can get there right from Aetna.com, but here's the actual URL on the screen too. You can flip to the next one. So like I said, create that online account as soon as you have your member ID. We also have a mobile version on both app stores. This is how you would best manage and navigate your dental plan, I would say. You can review the plan benefits on this. You can look at your out-of-pocket costs and the remaining deductibles. You can pay your claims, access a digital version of your ID card. If you are on the medical plan and you will have a different member ID number than for dental than medical. And if you already have this Aetna account set up and you don't see the dental information linked in there for any reason, call dental customer service and they can get the two linked. And you can also search for your dentists or specialists. You can use our cost estimator tool to see what you might pay for your next visit. And you can access some special discounts that we built in for some additional products and services. You can flip to the next slide. So feel free to take a screenshot of this slide. I think it's being recorded, but here are the links. We've got Columbia's Aetna Student Health page, the Aetna Dental PPO landing page for Columbia. You can learn a little bit more about the plan there and enroll from that page as well. The plan design and benefits summary link, the member website login, and the find a provider tool, which you don't even have to be a member to go if you wanted to go search for one. There's also the Aetna Dental customer service number if you have any questions or want to cancel the plan for any reason. And then there's the Aetna Student Health customer service number if you have any questions about the online enrollment process. So make sure you get your screenshots, or we'll put the links in the chat later as well, but you can flip to the next one. All right, so on to the vision plan. So just like the other slide for dental, you'll see the policy number and the effective dates in the top left. That's the same as dental, effective on August 15th and live until August 14th of next year. Again, fall enrollment deadline is the 30th of this month, and the cost is just $81 for you or $199 for you and dependents. I will say this plan is much easier to understand. There are in and out of network benefits, but still there's no type A, B, or C expenses or a deductible. So a little bit about the plan. Once every plan year, so from now until August 14th of next year, you have one eye exam, one pair of eyeglass lenses or an order of contact lenses, and a frames benefit. Now, the benefits are not the same in and out of network. Like for dental, you really save the most staying in network provision. That is the same as dental, but there is no co-insurance, only set reimbursements for certain expenses you'll see on the right-hand side. So there's a $10 copay for your exam visit, and then you have $130 to spend on either the glasses lenses or the contact lenses, plus 15% off anything above the 130. Now there's tons of glasses lens options that are also covered, such as scratch resistant coating, UV treatment, and tons more. Again, this is another snippet of the full plan summary, which again is on our website. You'd also have $130 allowance for frames yearly as well, and then 20% off anything over that allowance. So $81 for the plan, those big allowances, it's a good plan, in my opinion. And lastly, I'll say on a high level, you'll receive up to a 40% discount on any additional pairs of glasses or prescription sunglasses if you wanted to check those out. You can flip to the next one, Matt. So you might be thinking, oh, I really have to stay in network with this plan. But as you can see, 97% of our members are able to stay in network. So you've got this. We have over 170,000 providers nationwide, over 28,000 retail and independent locations. There's 8 online in-network options that are on the next slide as well. But we can flip to that now. So with these online retailers, you have free shipping and returns, and your insurance benefits are automatically applied online at checkout. You'll have to link it in some sort of way. But I mean, these are big brand names too. I mean, LensCrafters, Oakley, Ray-Ban, Target Optical. The message again is you should not have a hard time staying in network. Tons of options and getting the most out of your plan should be easy. We can flip to the next one. So what you will receive after enrolling, just like with dental, after you enroll in vision, it's the same method as before. You just select the vision plan, whether or not you want to add dependents, and you'll receive a welcome letter sent out to, again, the same address you used when you signed up. It'll look like these 2 screenshots on the right-hand side of the screen here, your member ID, some helpful information, etc. Just like with dental, you would want to set up your online account. Note that it is a separate website. I have the URL right here, but it's on aetnavision.com instead of aetna.com. We also have the mobile app versions. You can use either your member ID or the last 4 digits of your student ID number that you use when you enrolled to create your account. I think on the registration portal, it says something like it asks for your social security number, but we don't collect that at any time. So you can enter the last 4 of the ID number, I believe you used when you signed up, or your actual member ID when you get the welcome letter. We can flip to the next one, Matt. So different website, yes, but similar capabilities. You can view your benefits, download your ID card, find a provider, check on claim statuses, access special offers, and more. Yeah, you can flip to the next one. And then just like for dental here are some resources, links, phone numbers. Again, Columbia's Aetna Student Health page, the Aetna Vision landing page on the Columbia site, the vision summary of the plan benefits, the member website login, and the Find a Provider tool. There's also the Vision customer service number for any plan questions or if you need to cancel. And then again, the Aetna Student Health customer service number if you have any questions about the online enrollment process. And I believe that is it, and we can open it up to Q&A now. I haven't been looking at it, I will say, so see if there's any actions. We said 2 answered. Looks like Kevin's on his way for the second one, but yeah, I mean, we can go off mute, use the Q&A. And thank you for listening. Thank you, Kevin. Looks like you are typing that one out. Any other questions at this time, anyone? You've got us. You've got 3 Aetna representatives here. Hit us.
Well, Corey, I think that was so thorough that it's kind of hard to have a question after that.
It must have been. It's a great sign, then. I'll take it.
Any questions? Dental, vision, Aetna in general? The only thing I'm going to add, Corey,
Yeah.
is I don't know if you can go back, Kevin. There are 2 specific numbers when our students reach out to Aetna, depending, yeah, these group numbers. The group numbers are important because sometimes a representative will not know that we have dental and vision. I think it's because it's voluntary. But we stress that they should have those group numbers on hand.
Just typing some answers in the chat now, Karen. I guess I could say them also. So the question about the type A expense, if it's plus 10% of the cost. So for dental, if it's a type A expense, that means that for Columbia's plan, Aetna will pay 90%. The deductible does not matter for type A expenses. So Aetna will cover 90% right away. And then you would be responsible for the remaining 10%. Will Aetna reimburse full medical necessary contact lenses? I believe so. That will be in the full plan design. Let me open that up really quickly, but I believe so. Yes, Aetna will fully reimburse medically necessary contact lenses, confirmed, and that is in the plan summary as well. An example of the annual cost for a student that gets dental and visits 2 times for dental regular cleaning. So the question, can you give an example of the annual cost for a student that gets dental and then visits 2 times for regular dental cleaning? I recommend using the cost estimator tool on our app. Again, we do have the contracted rates with in-network providers, but that depends on which provider you go to. It could be slightly different, but covered at 90% for type A, the cleaning and the visits, it shouldn't be too significant at all. But again, the deductible doesn't matter. So yeah, it shouldn't be too significant. But I do recommend using the cost estimator tool if you had specifics. Do you pay deductible? Oh, it looks like Matt's typing an answer. Thank you, Matt. And Monica, if I didn't answer that in a way that made sense, please rephrase or drop a Q&A.
Okay, looks like you answered all questions. Oh, there's a new one. Put a link for the dental.
Is that the enrollment link or a link for like our homepage? Maybe that could be specified for us. Like you did.
Oh, I'll go grab that for you, Monica.
There's also a lot of links located in the chat. If anyone's looking for a specific link off this page that Corey has done for vision and dental. Okay, well, looks like just on time and, oh, somebody, how would I go about purchasing optical lenses and frames online and show that I'm covered by Aetna?
So there are all of those online retailers. I'm not sure of the full capabilities of all of them. Target Optical might be a little bit different than what Ray-Ban has to offer, but there should be a portion on their websites where you can maybe either search for insurance or find out how to apply your benefits at checkout. It is possible, but I mean, the way that I do it, if you did want to go in person, I'm a fan of Lens Crafters because there's a doctor and a retail store in the same spot most times. So I do recommend that. But yeah, every website might be a little bit different on how they like link you to your insurance plan. But you using that the member ID number would be your key. And I believe when you go in network in person, the secretary or whatnot could look you up just by your name and date of birth, I believe, if you're part of Aetna Vision.
Mhm. Hey, Corey, I'll piggyback off that and just
Yeah.
reiterate a point that Karen made earlier. It is helpful to have that group number as well sometimes, and it is should be on your ID card, when you have that. So in addition to your member ID, having your group ID, particularly if you're trying to, do this online, might be advantageous to have that, at the ready for you.
Thank you, Matt. Good point.
All right. Well, I think this was incredibly helpful for at least myself. Hopefully for everyone who joined. Thank you to our Aetna representatives, our team of experts. Thank you, Corey, for a very thorough presentation.
Sure.
And thank you all for taking the time out of your busy schedules to join us. We will have a follow-up or another one on Thursday, the 26th at 2:00. So if you have friends who were not able to make it and would like to join, please let them know there's another one at the end of the month on the 26th at 2 p.m. And Corey will be back. And I'm guessing Kevin and Matt, one or both of you will be
I'll be
joining
here.
again.
Yep.
So we will look forward to that.
All right. Awesome.
All right. So thank you, everyone. And here's to a great semester ahead.